Welcome to High Tea with Grace, where we spill the tea on HIT. I'm thrilled to be here at the ASCO conference interviewing the industry's greatest leaders in oncology. So tell me, who are you and what do you do?
So I'm George Sledge. I'm a breast medical oncologist, but I'm also Chief Medical Officer of Caris Life Sciences.
Excellent. Now, what trends are you hearing about in the ASCO hallways?
Well, certainly the big story this year, and a long-awaited one, is pancreatic cancer. For the first time in human memory, we actually have a drug that works in pancreatic cancer. And it's the result of finally understanding and applying that understanding of the biology of pancreatic cancer. Very, very exciting. This involves a drug that attacks something known as KRAS, which is really common in pancreatic cancer, something that we can pick up with our molecular diagnostic studies at Caris. If you have this KRAS, there is a version of KRAS that is either on or off. This has only been realized in the last few years. And this year, we've seen the development of a drug that is a RAS-on drug. So its name includes the title onrasib, which I find fascinating. And if you turn on to off, you can shut down the pancreatic cancer. Patients respond to therapy, live significantly longer. Most exciting news in pancreatic cancer in a generation or more.
So exciting and so fascinating to hear about how that could also potentially impact other cancers.
Absolutely, because RAS as a family, and KRAS in particular, is found in a bunch of different human cancers. And it has been one of the more depressing areas in oncology for a very long time. We've always known it was there. We could always see it off in the distance, but we could never reach it. Now, finally, we've got a drug that works on it, and there's going to be a bunch of other drugs in the pipeline that may work even better from the early going from data that was presented at AACR this year.
Wow. Now, I heard that Caris Life Sciences, alongside the Precision Oncology Alliance, are presenting 32 posters here.
Yes.
So tell me, what is one that really excites you, that you're really interested to share with the world?
Well, I'm a breast cancer guy, so there's not one, but a number of these that involve invasive lobular carcinoma, or ILC. Lobular carcinoma is like the weirdo among breast cancers. It grows in a different way. It spreads to different organs. It is one that makes you, as an oncologist, look pretty good in the early going, but as our data and other people's data have shown, is associated with a lot worse long-term outcome, a lot of late recurrences of ILC. And we're just starting to understand that. And so an abstract that Caris did along with one of the large cooperative groups, looking at a trial called N9831, one of the first trials of HER2-targeted therapy in breast cancer, allowed us to look at this. Another study that we did that looked at the biology of lobular carcinomas, looking at a molecular level, allowed us to tease apart the immune actions of having a lobular carcinoma as opposed to a ductal carcinoma. So I'm getting the sense, looking at this data that's come from Caris with our POA colleagues, that we're actually beginning to learn something that might be useful long term in terms of treating the disease.
So fascinating. Now, when we think of the future of oncology care and research, what excites you right now?
Well, what excites me is that for the first time, literally the first time in human history, we're able to take a patient's tumor, slice it and dice it, evaluate it, look at the RNA, look at the DNA, and actually understand what makes the cancer tick. And this has been a sea change that has been coming over the last decade, but is finally coming to fruition. I mentioned the pancreatic story. Well, that's a story that's possible because we're actually able to measure an oncogene that's present in a human cancer. And so, at Caris, our stock and trade, of course, is to do next generation sequencing on enormous numbers of human cancers. We're able in pancreatic cancer to take a close look at that and tell a patient, it's there, it's treatable. Your oncologist now has something available to us. I can tell you, having been in the biz for a long time, for a significant part of my career, I couldn't walk into a room and tell a patient that being able to do it now is really exciting.
Wow. Amazing. Thank you so much for joining me today, Dr. Sledge. It was great to learn from you.
A pleasure to speak with you.